Welcome to the PrepNet, presented every Sunday at 6 p.m. Eastern Time on Talk2Me's Channel 14. Come join us to discuss everything about prepping and hear what others have done. Medical Preparedness for Preppers, Part 4. Disclaimer. Please be aware that this series on medical preparedness may include topics or descriptions that some listeners may find uncomfortable. This presentation is for educational and preparedness purposes only and is not medical advice. We will not go into graphic detail, but we will mention topics and areas you may want to research further as part of your own preparedness planning. Medical procedures should only be performed by properly trained individuals operating within their level of knowledge, skill, and legal authority. In a real emergency, seek professional medical care whenever possible. In Part 3, we covered medications and long-term health conditions of the basic first aid supplies topic and started the advanced first aid and trauma training topic, including the next-level medical supplies and equipment, improvised medicine and austere care, medical reference materials, and sanitation and infection control of the advanced first aid and trauma preparedness topic. We will now complete the medical preparedness for preppers topic. Disasters create enormous stress. Fear, exhaustion, grief, sleep deprivation, isolation, and uncertainty can damage decision-making and physical health. Preparedness groups should consider stress management, sleep schedules, emotional support, conflict reduction, maintaining routines, morale-building activities, and community cooperation. Mental health problems can become force multipliers for other emergencies. A tired, stressed, emotionally overwhelmed person is more likely to make dangerous mistakes. One of the greatest preparedness advantages is having medically trained people in your group. If possible, preparedness groups should try to build relationships with doctors, nurses, EMTs, paramedics, firefighters, military medics, dentists, pharmacists, veterinarians, caregivers, and mental health professionals. These individuals bring knowledge, experience, calm decision-making, practical treatment skills, understanding of medical priorities, and the ability to train others. Even a retired nurse or volunteer EMT can dramatically improve a group's survival capability. Preparedness communities should also cross-train members so that medical knowledge is not limited to only one person, and regular group medical drills or emergency scenarios can help keep those skills usable under stress. If the only trained medical person becomes injured, absent, or exhausted, the group still needs backup capability. Good communication saves lives. Important information should be documented clearly. Preparedness medical records may include allergies, blood types, medication lists, medical conditions, emergency contacts, vaccination records, insurance information, and copies of prescriptions. In larger groups, patient logs and treatment records can become very important. Documentation helps track symptoms, medication schedules, vital signs, fluid intake, injury progression, and contagious illness spread. Ham radio and emergency communication systems may also become valuable when normal communication systems fail. Large disasters often overwhelm professional emergency systems. Communities that cooperate generally perform better than isolated individuals. Community preparedness may involve shared medical training, neighborhood response teams, medical supply sharing, welfare checks on vulnerable people, shared transportation plans, communication networks, and community sanitation planning. Preparedness is strongest when knowledge and capability are distributed across a group. Medical emergencies can involve difficult ethical decisions. People should understand consent issues, scope of training limitations, medication laws, liability concerns, documentation importance, and Good Samaritan laws. During severe disasters, people may face difficult choices involving limited supplies and competing priorities. Training and planning ahead of time can reduce panic and confusion. Medical preparedness is not about pretending to become a hospital. It is about increasing your ability to stabilize injuries, prevent illness, care for loved ones, and survive long enough for recovery or professional care. The most important medical preparedness tools are training, knowledge, prevention, sanitation, organization, calm decision-making, and community cooperation. Start simple. Build skills gradually. Practice regularly. Improve your supplies over time. And whenever possible, surround yourself with capable people who bring valuable medical knowledge and experience to your preparedness group. A prepared community with trained, calm, organized people can save lives when normal systems fail. Medical preparedness is not a one-time purchase. It is an ongoing process of learning, organizing, practicing, and building resilience. Next week, we'll start a new topic on food preservation. If you have any questions about what we have discussed here or anything about prepping, send your question to prepnetch14@gmail.com and enter question in the subject line.